Thank you, Steve. Thank you, everybody, for sticking out here for a wonderful well day. Of course, I want to thank Alex and Bernie and all of you for giving me the privilege to come out here and talk to you guys about certain things, about medications and things like that. First, I have to put a plug in for some of our UCLA things. Up here, I have our brochures for our UCLA Gambling Studies program, where we're studying all things related to gambling, the causes, the courses, and figuring out things to help people stop gambling. And lastly, we also have a brochure for the first state-funded treatment program for anyone suffering from a gambling addiction or a family member suffering from a gambling addiction, so that's completely free. So those are brochures that are here there for you as well. So what I really want to talk about today is really not just about meds. Now, I usually have the PowerPoint slides and all that fancy stuff. I don't have that. I'm really talking from the hip today. So I really want to give you an insider's view of what goes inside the heads of psychiatrists as we write those prescriptions. So usually it's our job to look inside your head and to say, this is the medication for you. But I really want to debunk some of that and give you an idea of what actually we're thinking. Because as I think about it, medicines are only one small slice of the recovery pie. The one small part of the wellness pie. To back up a little bit, I think about the whole concept of wellness. As you've seen today, it's not just one thing, it's a variety of things. Physical, spiritual, mental, financial, legal, social. I thought about my own life. What are the things that I've done in the last 2 weeks that helped me stay well? Went to my son's soccer game today. I went to the Journey concert on Tuesday. Yeah!
Don't stop believing.
Don't stop believing. I want to know what happened before. I had lunch with a wonderful friend. I went out and planning a surprise party for my wife tomorrow. Don't tell her, by the way. So these are all the things that are allowing me to be well, to have a positive outlook on health. I exercise 3 times a week. But one of the things we think about medications is how can medications get us well? How do medications let us act well and be well so that we can do well? So let me just start off at the top for a couple things. First, the definition of a drug is very simple. It's any substance that you ingest that changes bodily function. That could be good, that could be bad. But it's anything that you ingest that changes bodily function. A medication is a drug that restores normal bodily function. So think about that. For a long time, we mixed in those terms. Drug, medication, thought my drugs aren't working, my meds aren't working, my meds are making me sick. But oftentimes we forget that. Medications are really meant to make you well. They're not meant to make you unwell. And unfortunately, in this country, we've become a dependent country on medications. As an example of some basic statistics, over $300 billion was made last year off of prescription medications alone. $300 billion. Sales of cigarettes was only $20 billion. Sales of alcohol was $80 billion. So we're spending more on drugs and medications than we are on tobacco and alcohol. At Bet Shuva, where I also work, how many people know about Bet Shuva, the residential program out there in West LA? So I was talking to Harry Rosetto yesterday, and she was telling me that about 15 years ago, only about 30% of the clients there were on psychiatric medication. In 2011, it's 95% of their clients are on psychiatric medications. She and I looked at each other and we said, that is wrong. There are some clients who clearly need to be on medications for the disease part, for medications to make them well. And there are others that are using medications as drugs to change the way the body is functioning, to change the way they're feeling. So those are some of the things that we're seeing out there in the real world. If you look at the top 200 drugs or medications that are prescribed, top 20, about 7 out of 20 are psychiatric medications. About 5 of them are pain medications. So you really add them together, about over 60% of the top 20 medications that are prescribed are really medications that are being used to alter people's brain function. The number 1 is still Lipitor, which is for cholesterol. And Viagra and a lot of those other ones are actually still very, very high up. But again, the prescription medications for psychiatric medication is very, very, very high. So I'll describe for you what I do when I see patients behind closed doors. How do I look at the role of medications in recovery? And again, I think I take the minority opinion of what a lot of our psychiatrists do, which is that I really believe medications are, again, one just small sliver of the recovery pie. If you only do meds, you're only going to get one piece of it. If you do all the other things and you don't do meds, you're not going to get a full course of recovery. So I really think about it very simply. The motto is, I believe that medications are here to lay the groundwork for recovery. They allow you to change and restore your brain functioning to be able to do the recovery work. Well, what is the recovery work? Everything you've been hearing about today. It's the wellness approaches to life. Number one, starting off with sleep. You need 7 hours of sleep, ladies and gentlemen. How many here in the last week were able to get 7 hours of sleep every night? I know Alex certainly doesn't. He's Facebooking at 2 a.m. I see who you're chatting with. 7 hours of sleep. So medications can help restore natural sleep. Now there's a difference between medicine just knocking you out and medications restoring the sleep parts of your brain that have been affected by depression, anxiety, or years of drug abuse. That's number one. Number two, how many of here have been able to exercise 3 times a week over the last 2 weeks? Again, so how can medications help you exercise? Well, yeah, it can help take away some physical pain, but more importantly, they can give you the motivation. One of the things that I realized about early recovery in rehabilitation programs is people come here and they get what? Inspired. This is it. I'm finally doing it. I've never felt this good about my recovery, ever. But the problem is that inspiration doesn't turn into motivation. And motivation then doesn't turn into lifestyle changes. So what we're looking at is medications to help people get that energy, that drive, to flip that switch back from being inspired to staying motivated. You know, oftentimes when patients come and say, you know, I need to lose 10 pounds. I only want to do it for about 3 months, and then I'll go back to eating Krispy Kreme. I'll say that is not going to work. What you're trying to do is take a Band-Aid approach to lifestyle change, instead of making a full 180 change. All right, so sleep, exercise, and now nutrition. You've heard an incredible amount about nutrition. I feel that medications can help restore appetite and the drive for food when it's done correctly. When it's done incorrectly, what do? They take away that drive. They make you not want to eat. Or worse, in this case, some medications increase that drive for hunger to the point where it becomes compulsive and you're overeating. So it really needs to be a balance. So we really need to look at how do we get medications to increase your appetite. So many times when I'm working with clients, they say, you know, doc, I don't want a medication that will cause me to gain weight. And I say, of course not. But I'll say to them, I want a medication that will let your brain heal, that will allow you to do the recovery. And if you have to gain 3 to 5 pounds in exchange for an incredible amount of wellness in your life, that's what I'm selling you. If that's something you're not interested in, we got to go back to the drawing board and find out where we're missing. So again, sleep, exercise, appetite, and the fourth real critical component of what medications really ought to be able to do is to help people manage stress. So often we see patients come into the hospital and they get a breakup with a boyfriend, they have an incredible stress response, they cut on their wrist. Or they get a bad news, they get fired, they have an immediate reaction, they swallow a bunch of pills, or they go out and get cocaine, or go to the casino. You think about a stressful response to stress. They're reacting immediately, quickly, impulsively. So what we want is medications to increase that length of time from when you have a negative life event or a stressful life event to allow you to manage stress. So you think about, you get the news, Alex, I'm breaking up with you, I'm sorry. It's not you, it's me. It is you. Sorry. Immediately, Alex has this tremendous outpouring of emotions, stress hormones flowing out, epinephrine, fight or flight, sweatiness. Those are automatic responses. And in many patients, it's fine. But oftentimes in cases of depression, anxiety, post-traumatic disorder, any form of addictive disorders, these reactions are pathological. That's where medications can help slow that down. Give you some space to think. Give you space to use the wellness tools and recoveries that you've learned over your time in recovery. The fifth part, again, is attention, learning, cognitive ability. So we all know that at our peak, we only have about a 20-minute attention span, which is why I noticed the talks today are about 20 minutes. But that's at our peak. Think back to high school or college or even junior high, how hard it was to hear someone go on and on past, you know what I'm talking about, right? And math and algebra. This is annoying, annoying. And this is really where you imagine depression, anxiety, stress, coming down through detox, having cognitive impairments from methamphetamine. You can't listen, you can't attend. Well, that's really where we think the role of medications are out there to really help people listen and learn and sit still. So these are all the phrases I use with clients and patients saying, you know what, this isn't a magic pill that will make you better. This is not a magic pill that will take away your feelings. This is not a drug that will change you into someone you aren't. These are tools. These are things that will use to help you tolerate life better, to be able to engage in the other parts of recovery so much better. So that's the sales pitch that I usually use. And I found, you know, when I gravitated toward that, it made so much more sense because it really was true. It was humanistic, it was earnest, and I believed in it. Much, much more different than when we're taught in medical school and residencies to say, I'm the doctor, you're the patient, here's my prescription, take 2, and don't call me, just come back. And too often we still see that. So we're really trying to change that culture out there at UCLA with our residents and our med students and really emphasize this overarching thing. The last thing I'll say is really emphasizing the role of medications in recovery. We now have a whole toolbox of medications for addictive disorders that were not there 10 years ago. Now, there are many myths related to some of these medications, including Chantix for smoking, Suboxone for opioid dependence, Camprol for alcohol, naltrexone for opioid dependence. And again, as in any other field where there's change, there's resistance, both good and bad. But again, I can tell you I've been prescribing Suboxone for almost 8-9 years now. It's saved hundreds of lives. It's also created lots of problems as well. This is going to be true for any new innovation. The difference between an invention and an innovation. The invention will work inside your garage. I had a friend who had an invention for a keyboard where it was a Q, and you would type like this, it would get rid of carpal tunnel. But he couldn't get it out to mass distribution. The iPad is an innovation. Everyone's using it. It's changing how we work, how we function. So I would argue that many of these medications in addiction are innovations to the field. So whether it's Suboxone or naltrexone or Chantix. And because of that, we really need to embrace that to figure out how do we use this as part of the wellness recovery and not to stave off and say, no, we don't want these things here. No, we don't want them part of it. So again, that's why I really embrace the 180 concept to say, you know what, instead of banning medication, instead of taking people off everything, or just flooding people with a bunch of medications, let's be more realistic and thoughtful as to how they actually relate and how they actually will improve wellness. Okay, so those are my main take-home points. The idea is that there are many myths about medication. There are many things you can see on there. And a lot of times what I spend in the office is trying to be that used car salesman. Trying to say, you know what can I do for you today, Alex, to get you to take this medication for you or for yourself? And it's challenging and it's frustrating. And when we're in the hospital setting and we see patients who go off their medications that are restoring their normal functioning in their brains, and their signs and symptoms of their disease come back, that's difficult. But again, one of the things I think is so hopeful is that what we do every day is a real privilege, and we never know what's going to happen. And every day when we're working with clients that are difficult and that have relapsed and have slipped, we always go back and say, you know, what are we doing differently? What could we be doing instead to add to this recovery pie, to this wellness piece, to really make things better? I'll leave you with that, and basically